ashver.com.
Hello, welcome to ashver.com. You are watching an interesting video about bariatric surgery for fast weight loss. Please read the disclaimer carefully. Bariatric surgery for fast weight loss. For people who desperately need to lose weight, but who just can't, bariatric weight loss surgery is a viable option. Men and women who are obese and have spent many discouraging years stuck with excess weight, surgery to change their bodies can seem like a magic bullet. Indeed, statistics indicate that anywhere from 50% to 100% of excess weight is usually lost in a relatively short time after bariatric surgery. In order to help you prepare for a discussion with your doctor about surgery to lose weight, the 3 types of bariatric surgery are discussed here. Each type of surgery has as its objective the reduction in the size of the stomach. Of course, no surgery is without the possibility of complications, and weight loss surgery is no exception. Pros and cons exist for each procedure. Even so, when compared to the many health problems associated with obesity, and the personal discomfort it causes, going under the knife to reduce the size of one's stomach is becoming a smart option for more and more people. Gastric bypass surgery. The most common type of stomach reduction surgery is Roux-en-Y gastric bypass surgery, usually simply called gastric bypass, which carries minimal risks when compared to the other weight loss procedures. In gastric bypass surgery, the surgeon ties off a walnut-sized section of the stomach, often referred to as a pouch, and all the food you eat goes here, not into the rest of the stomach. The rest of the stomach is essentially blocked off. Then the surgeon redirects a portion of the small intestines, called the jejunum, to a small opening in the pouch. Food goes only into the pouch, then into this portion of the small bowel. The pouch can only hold a few ounces of food at a time, as opposed to the stomach, which can hold about 3 pints, so the amount of food and calories a person can eat at once is greatly reduced. Gastric banding surgery. The gastric banding procedure, also called lap band surgery, is similar to gastric bypass. A silicone band is tied around the upper part of the stomach to create a smaller section or pouch, so less food can be consumed at once. The silicone band can be adjusted by adding or removing silicone to the band as needed. A connection to a port placed under the skin in the abdomen makes these adjustments possible. Unlike gastric bypass surgery, no changes to the small intestines are made. When the pouch is full, signals are sent to the brain to indicate a feeling of fullness and satisfaction. These are the same signals that the full-sized stomach would send after a person is finished eating. But now the brain gets these signals a whole lot sooner, because they're coming from a pouch that is much smaller in size than the stomach. Vertical sleeve gastrectomy. A vertical sleeve gastrectomy is a surgical procedure in which at least half and sometimes up to 85% of the stomach is actually removed, and the rest shaped into a vertical tube that is described as the shape and size of a banana. The new stomach is kept closed by surgical staples. The sphincter muscles at the top and bottom of the stomach remain. The tubular stomach can only hold 1 ounce of food. Until recently, this procedure has been mainly preserved for the most obese patients whose weight disqualifies them from a gastric bypass. The idea is that since the vertical sleeve surgery only allows a tiny amount of food at once, it will force enough weight loss so a different procedure can be later performed. Also, the portion of the stomach that is removed is the part that contains the hunger hormones, so a decrease in appetite is a common side effect. However, just like a normal stomach, the tubular one can be stretched through overeating. It is imperative that the patient exercise tremendous discipline and make drastic adjustments to his or her eating habits. Otherwise, the long-term success of a vertical sleeve gastrectomy is put at serious risk. In spite of these concerns, an increasing number of obese patients are choosing the vertical sleeve since they can come out of this surgery without something foreign being left in their. Risks of gastric bypass surgery. The risks of gastric bypass surgery largely have to do with nutrition. Since food bypasses most of the stomach and some of the small bowel, the absorption of important nutrients is automatically reduced. Long-term deficiencies of iron, B12, and folate become a problem for some people who undergo this surgery. Extra care is needed to maintain the appropriate diet and the right regimen of nutritional supplements. Research has also linked gastric bypass surgeries to a complication called gastric dumping syndrome. This syndrome happens when undigested food passes from the stomach to the small intestines. Given the smaller amount of food one can eat with only a small pouch instead of a full-sized stomach, it is easy to understand how this can become a problem. The result is often abdominal cramps, nausea, and diarrhea. Thus, it is crucial for a person who has had this surgery to learn new eating patterns. Only small amounts of food can be eaten at any given. Risks of gastric binding surgery. The main problem with gastric binding, or lap band surgery, involves slippage of the silicone band out of position. When this happens, the pouch becomes bigger, with accompanying heartburn, nausea, and vomiting. Additional surgery is required to fix the band. Statistics indicate that this happens to about 1 in 50 people. Another sometimes side effect of lap band surgery is the development of the intolerance of certain foods, such as red meat or green salads, or something else a person is used to eating. Oddly, this food intolerance tends to happen several years after the surgery. Scientists don't have an explanation as to why this happens. Risks of vertical sleeve gastrectomy. Even though the new stomach in the shape of a thin tube can only hold an ounce of food, nevertheless it can be stretched to accommodate more, especially since the type of bariatric surgery does not involve any intestinal bypass. The discipline needed to only eat a tiny amount at once so this will not happen is a serious challenge. For this reason, and since there is no bypass of the intestines, the weight loss results from this procedure are statistically not as great as for the other weight loss surgeries. Therefore, this surgery is often done as a prelude to another one. Nevertheless, vertical sleeve gastrectomy as a standalone weight loss procedure is gaining in popularity. Qualifications for bariatric surgery. Until recently, bariatric surgeries were only offered to patients with a BMI, body mass index, of 40, whose other problems like diabetes, obstructive sleep apnea, or heart disease, made it imperative that the obese person lose weight. A weight loss doctor would also evaluate how long the person had been obese, and how long he or she had been trying to lose weight. A person's motivation to alter his or her eating habits and maintain new lifestyle patterns would also be an important consideration. However, the requirement for a BMI of 40 is no longer set in stone. In the interest of enhancing the health of someone with other serious health concerns such as those mentioned above, weight loss surgeries are now sometimes offered to persons with BMIs in the mid to late 30s. In fact, it is no longer unheard of for bariatric surgery to be offered to diabetics with BMIs in the low 30s, if all other options for weight loss fail. Conclusion. The purpose of this article was to give a basic understanding of the 3 types of bariatric surgery, so the reader will have some direction when discussing surgical weight loss by stomach reduction with his or her doctor. Surgery of any kind is always serious business. As with any decision affecting your health, the more you know and understand, the better. Thank you for watching this video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find lot of interesting videos on wide range of topics here. Stay tuned and keep watching.